Hey guys, Brandon here again for NCO Level 1 Education course. This is Module 3, Teaching the Hinge. So what is a hinge? Total body movement, primarily targeting all musculature in the posterior chain, so back side of the body. That's going to be hamstrings, glutes, spinal erectors, lats, and traps. This is a big foundational movement pattern that happens, you're going to use throughout the day for a variety of things, both in soldier tasks and life tasks. Pretty much anytime we're picking up or lowering something from the ground, we should be utilizing this pattern. So hinge mechanics, technical pillars, again, much like the squat, they're going to look the same regardless of, they should look the same regardless of the individual. However, the visual picture that you're seeing is going to vary depending on the limb length, flexibility and mobility of certain joints, etc. So again, they should be executing the same technical aspects, but the visual package that you're seeing may look slightly different depending on the person. So again, starting at the feet, you want to start with your feet directly underneath your hips. Toes should be pointed straight forward. Maintain full foot pressure, again, through that tripod we talked about in the squat presentation, and especially through the toes as we hinge. So this is sometimes a common error with hinging. We don't want to hinge and lose the pressure up here and go onto the heels. Make sure it stays full foot pressure. And then one thing to note, the feet are much narrower here under the hips versus under the shoulders in a squat. So they should be much narrower hinging than they should be in a squat. Moving on to knees here, always unlock or soften the knees before going into descent. You should maintain a slight bend throughout the hinge and avoid squatting. So you can see in these pictures here, this is a great example. There's a soft bend. The knees have stayed kind of over the ankles here as the hips travel back. Here you can see the knees are too straight and they haven't really unlocked at all, which is putting all the strain here rather than in the hips as over here. And then in this picture you can see this is more too much of a squat, too much knee bend. We're not looking for that. We're looking for this right here in a standard hinge. Hips and torso, again, find that neutral pelvic position. We keep harping on that, going back to that first presentation, but that's why it was first. It's very important. Okay, nice neutral position here. Good. If possible, you may go into a little bit of anterior pelvic tilt, but anything more than this is what we want to avoid. But a little bit of anterior tilt or neutral is fine. We do not want to see this rounded posture at all. That's going to be the most significant thing we got to fix. Make sure this isn't happening. A good cue is to treat the torso from the hips to the shoulder as an immovable board. So once I start moving the hips back, nothing changes in this pattern. All the motion is here or there. That's it. Still on the hips and torso, focus on horizontal displacement here. So the hips should be reaching back as far as you can. Once you can't reach back anymore, then that's when you're going to return to the top of the movement. You can see the difference in how far she's pushed her hips back here versus in this picture. You can also see she's a little straighter than she is here. It's not terrible, but she's straighter here than here. Hips are too far forward, and then you can also see that this bar is kind of out in front of her. You want to have this nice and tight to the legs. That's going to allow you to, one, better push the hips back, and two, keep the weight from whatever, whether this is a bar, kettlebells, whatever, in the hips rather than transfer up towards the low back. And then again, keep these hips tall, as we talked about on the previous slide too. They shouldn't come down. It should just be straight back, and then they come straight forward to finish. So kind of wrapping that up, set up position, feet under the hips with a neutral pelvis, unlock and soften the knees as we go down. Brace, again with that good torso brace, slight, very, not aggressive, but enough to support your low back. Reach the hips back, let the shoulders start to come forward, but as an immovable board. We're not bending over, you're just hinging. Okay, you want to feel that stretch in the hamstrings here. Keep that weight implement, kettlebell, dumbbell, barbell, whatever it is, nice and close to you. Don't let it get far away from you. Maintain a nice rigid torso. And then we're going down or hinging until our hips can no longer reach back any further, and at that, before the torso position is lost. So I reach as far as I can, or until myself or my soldier loses proper torso positioning. At that point, they're going to return back to the top. So on the way back up, bring your hips to the bar. So these two pictures here, this is what we want. She's driven her hips to the bar and that's it. We're not trying to extend and lean back further. We don't want to envision pulling the bar up through the low back. Once I get the bar off the ground, returning to the starting position I'm sorry, not off the ground, but in a hinge here. On the way up, I'm just thinking about driving my hips to the bar rather than leaning back or trying to pull from the low back. It's driving through the hips. Here's our hinge continuum. So if you remember in the squat presentation, we had a squat continuum. This is our hinge one. Again, that doesn't mean that barbell deadlift is better than plate good morning or vice versa. It's just complexity, intensity. These are less complex and usually less intense, which makes them better for learning. As we get better at the movement, we can move up in complexity or in intensity. It's probably the most important movement pattern that your soldiers can learn. And if we want to make sure that we teach it and progress it properly so that A, your soldiers physically develop well, but B, we maintain really good health. If you get this particular movement wrong, the hinge pattern, then that's where we see the most common injuries occurring, and especially that low back. If we go back to the pelvis presentation, we talked about that. So make sure that we really teach people how to hinge very well, because if they can hinge well, we can do a lot of other things after that. But if we can't, we're most likely asking for injury. So first up, body weight hinge. Again, that hinge technique 101 that we talked about in a couple slides ago. But reach the hips back, nice rigid torso, good brace, soft knee. Once the hips can't reach any further, everything comes back to the start. Sometimes it can help, as you see in the video here, for Andrew to place his hands on his hips to help guide the hips backwards, and then you can feel you drive your hips forward into the hands. It's a good cue if somebody's struggling. Next up, plate good morning. So you can see Justin unlock his knees here and then reach the hips back as he comes down, holding this plate nice and tight to the body, and then drive those hips forward to return to the top. Make sure, again, as like with the goblet squat on the previous presentation, keep this weight nice and tight to the chest. Don't let it get away from you. You want to hold it nice and tight and keep it there throughout the motion. Moving now to dumbbell or kettlebell RDL. So this can be done with one dumbbell or kettlebell, or two dumbbells, two kettlebells. If it would be one, you would want to hold it with both hands right in front of you so that it drops down in between his feet here, right there. If you've got two, as you see as he does the movement, kind of right off the side, the front or just to the side of the legs is often more comfortable. Technique stays exactly the same as the previous two variations. We should have nothing different other than now with the weights being kind of in our extended arms, you really want to keep it nice and close. Don't let it get away from you. That's why oftentimes with dumbbells or kettlebells, you can see Andrew kind of switch partway through there to having it kind of more like on the 45-degree angle of his leg rather than way out in front. A lot of times that feels more comfortable because it's closer to you. Hex bar or barbell RDL. These are both going to be performed exactly the same. It's just the only difference is kind of where we're holding the load. So with a barbell RDL, it's going to be slightly in front of us. So we got to make sure we keep that weight nice and close as we reach those hips back and execute a good hinge. With the hex bar RDL, your hands are already at your sides, so you don't really need to keep it close to you. The big thing is just make sure we're not leaning back, make sure we keep good full foot pressure. With a barbell, keep those knuckles down and the bar tight. With the RDL, grip the center of the bar. Or I have heard a good cue recently from a soldier is if you struggle with the hex bars we have here kind of twisting in your hands, you can alternate your grip a little bit. So maybe put the right hand further to the front and the left hand further to the back. That may help offset the bar wanting to twist. Okay, we're switching gears a little bit now. So those were pure hinges. An RDL is kind of a pure hinge. We start at the top and then we go down towards the bottom and return. We're now moving to a hex bar deadlift. So now we're starting from the floor, coming up to the top, and then returning to the ground. So for this one, you're going to stand in the middle of the bar with your feet between hip to shoulder width apart. So for this, feet may be slightly wider than they were in the RDL. That's okay. You're going to hinge down to grab the bar. So hinge as far as you can. Once we grab the bar with my hands, you are going to pull your hips down a little bit. So this is kind of a hybrid of a squat and a hinge. The predominant motion is hinge down, and then you're just going to pull those hips down a little bit so that we're in a good position to start. That good position is hips down, chest up. So your hips should be higher than your knees. Your shoulders should be higher than your hips. And you should have shoulders over the knees. You can think of it kind of as like a wedge position. Make sure here that we're controlling the bar back down to the ground in reverse order of what we did on the way up. Make sure also that we're not bouncing off the ground. The whole point of doing this correctly is to create good tension to pull from. If I start banging the bar off the ground, I'm going to lose that tension, or that protective tension that we've generated, and I'm going to open myself up to a higher risk of injury. If you are watching your soldiers from the side, the bar should be moving in a straight up and down pattern. There should be no movement front to back at all. Similar position, setup position with the barbell deadlift here. It's just now the weight's in front, so we're going to make sure that our shoelaces are under the bar when I look down. Grab the bar, pull your hips down, chest up. Again, create that wedge position just like with the hex bar deadlift. Knees should be slightly in front of the bar at the bottom, and then as we stand up, they'll kind of pull back out of the way. Again, make sure here, as with the hex bar deadlift, that shoulders and hips are rising together. We don't want to see the hips shoot up first and then the shoulders come. Everything should extend at once. Bar stays nice and tight. Squeeze your butt forward, drive the hips to the bar to finish it, and again, don't bounce. So, common technical issues that we see with hinging and how to fix them. First up, back rounding. This is probably, again, like I said, the most important one. We've really got to make sure that people aren't doing this. So, this often is just lack of creating a good brace to help tie that whole torso together. So make sure that we're in good braced position, good pelvic position, and then create some good tension, squeeze with the lats and the upper back to help lock that in. Oftentimes the other thing you'll see is reaching the barbell way out in front right here. Keep this nice and tight, again using that tension with the lats and the upper back, and really load the hamstrings and glutes. Reach back with those hips as we come down. You can see here there was no reach, we just bent over, reach back, flatten out, be in much better position. Squatting the hinge. So a lot of times people will have too much up and down movement rather than front to back. Remember, for the hinge, we're just talking about like RDL here. We want those hips to go front and back. So make sure that you're cueing them to really keep the legs long, reach the hips back. Once they can't reach anymore, they drive the hips to the bar. They should feel a good hamstring stretch. If necessary, some people just have really tight or weak hamstrings and they can't get very far. So if that's the case, just reduce how far they come down their leg so that they can do that part properly. And then as they get stronger, as they get a little more mobile, which the RDL will help with, they can start to reach lower. But if they can't reach all the way down to bar just below the knees and do it correctly, just have them stop a little bit higher, maybe above the knee at first, and then as they get better, they can start to reach a little lower. If the weight's getting away from your body, coming back to this picture we had earlier, make sure your lats are engaged, kind of roll those shoulders, squeeze the shoulders down and back, have nice tight tension, keep that bar close to you. And then if we're bending at the back, again, make sure we're loading the hips. Reach the hips back and keep the weight tight to the legs. If you see too much knee extension, as you can see here, so like straight legs, knees are now behind the ankle, make sure that we're unlocking the knees before hinging and that we're keeping full pressure through the whole foot. A really easy way to ensure that both of these are happening is just have your soldiers slow down the tempo of the movement, make sure that it's being executed with a good technique and that they're not just blowing through it by going really fast so they can move on to the next thing. Good control, soft knee, reach the hips back. Moving to that deadlift, some common technical issues you might see. So first up here we have hips shooting up. You can see in this picture on the left here, on the right, that start in a good position and then hips have risen up, so now they're even with the shoulders. That's going to put all the stress here through the low back as he attempts to lift this bar up. We want to avoid that. So a lot of causes from this could be not creating enough tension from the start, weak quads, possibly hips too low on setup if you squat it too much, Your hips have to rise a little bit before you have any tension in your arms, so make sure that you're not too low. And then if the bar is too far out in front, so obviously to fix those, make sure there's enough tension from the start. Make sure that you cue yourself or your soldiers to keep your shoulder height above hip height while pulling. So again, you can see here, like I said, that the hips and shoulders are now even, whereas we'd rather them stay in this position. Adjust hip height so that you're not too low, there's not too much slack in your arms, and then keep that bar nice and tight to your body. Back rounding, you can see here, rounding in the low back, well the whole back, but especially the low back, or here rounding through the upper back. We want to avoid either of these. Oftentimes this is caused by not creating enough tension before pulling, your hips being too low on setup, or using your back rather than legs to pull. So make sure you're, again, getting the hip position right for people to start with, a nice neutral spine and pelvis, and then reinforce driving through the legs to initiate the pull rather than thinking about pulling from the back. So in summary, properly teaching the hinge and deadlifts is one of the most valuable tools to overall physical development. It's one of the things that'll set you up best for health in the Army and health in life after the Army or outside of the Army. Deadlifts are not bad for your back, but they can be if your technique is bad. So if we're doing that improperly, we're going to have a risk of injury. But if we do it correctly, they're not bad for you by any stretch. It's easier to teach a hinge from the top down, so RDL first, that's why it came in the presentation first, then deadlift, because it's easier to maintain tension from the top than it is to try to generate it from the floor. So if you have soldiers struggling to learn this movement, start with an RDL, then move to a deadlift. And then because hinging patterns develop the posterior chain, they're extremely important for improving resilience to injury. So your posterior chain, hamstrings, glutes, spinal erectors, lats, traps, are all hugely important in developing a resilient body and a body that's going to resist injury under load. So getting very good at these things are getting very good at doing movements, hinging for the posterior chain is going to be extremely important for improving that resilience. This ends level 3. Our final and fourth and final module will be upper body pushing and pulling. Thanks, guys.